The 45 and up study is a long-term study that's been following a large number of people in New South Wales, over 250,000 people, for over 15 years. And it's a really important study because it's telling us a lot about people's experiences as they age, how people's lifestyle, how their behaviours, and how their use of health services affects the type of health conditions they might have and the treatments that they seek. So what's really important with this study is we use all that data that we can collect from participants and feed that straight back into decisions that are made across the health system to improve services.
So every 5 years, participants are sent a big survey. It's really comprehensive. It digs deep into questions about their lifestyle, about social factors, and of course, it asks a lot of health-related questions. So it allows research into these really important diseases and to come up with ideas, outcomes, better health services that actually will support health and wellbeing of Australians.
45 and up is by far and away the biggest study of its kind in Australia, and it's one of the biggest cohort studies in the world. And this really is the most in-depth slice of life, if you like, from a health point of view, that is so important when we really need to do those deep dives to understand risk factors for cancer, the costs of cancer, and cancer outcomes. So it's just been an incredible resource for cancer researchers.
So the 45 and up study, because it's such a large study of 250,000 people and such a wide snapshot of the people that live in Australia and particularly New South Wales, it really helps us to understand the whole range of risk factors that can contribute to heart disease. So that's understanding things like physical activity, obesity and diet and a whole lot of other contributing factors. But it's also helped us to understand how can we make changes to policy and how can we make changes to treatment and care and practice as well.
45 and up includes many people from diverse backgrounds, including a large number of people from Aboriginal and Torres Strait Islander background. We also have people from different cultural groups, non-English speaking, many people from remote and regional areas of Australia, so diverse geographic areas. We've had over 150 projects, over 750 researchers working on 45 and up data. They've produced over 400 publications and high-level research journals. There are 40 policy agencies that are involved with 45 and up and using the data to inform better decisions. So the impact of 45 and up is really far-reaching.
We've achieved a lot. There's important challenges emerging in the next decade. Clearly right now, the whole world is challenged by COVID, and there's a real opportunity for us to understand the impact of COVID restrictions and in fact COVID infections on the population here in New South Wales. There's emerging challenges in how we respond and improve our efforts to prevent disease and how we respond to improving our efforts to treat disease. And the 45 and up study is really well placed to understand those things and help our health system improve.